some interesting form of PowerPoint. Do you see a presentation, dear students, at this time? I look in chat. Please type, do you see a presentation? We have some gap of translation over 10 minutes, 10 seconds, 15 seconds. Please type, I want to know. We see my screen on you. Yes, okay, thank you. Lord Scott, yes, okay. Bioethics, what is it? What's the discipline? Bioethics, it's some young branch of knowledge, and it's in your slide you see that bioethics, it's living, some system, living system, living organism, yeah, it's our nature. And ethics, yes, ethics, it's a part of philosophy about our moral standard, moral questions, virtue, and ethics consist of two parts, yeah, morality and another ethic questions in this part, and it's a field of your background of knowledge, because we see some problem in medicine. We may understand, or we may think about this, that medical practice, it's a very conservative knowledge and branch of working, and any new methods and new treatments very hard come to our practice. And in contemporary scientific fields, we see that we have a very quickly growth of any branch of knowledge, yeah, math or IT technology. We have very quickly growth, and in medicine we have this growth of knowledge, growth of technology, and we have any block point to translate this practice in these methods in our practice, yeah? Because we have some ethic aspects, and it's important to understand that first, because we have many historic facts. When we think that it's very good practice, it's very good methods, it's very good pills, and start to work with this and have huge problem at the future of these methods or pills. And bioethics is one of questions of this discipline. It's ethics standard in our medical practice. Today, our two lectures, we talk about this. We introduce with some historic fact about this. It's interesting and dangerous information. Some of this we may hear in your classes on school, because it's international historic facts. And ethics standard come to our practice to search some problem when we doesn't see any aspect of treatment, and in all branch of knowledge we have a balance of two flow: balance with technical progress and balance with ethic and mental understanding this. Okay? And ethic is the first. We may hear that we may read about this, that in a future we have some very modern professional, and one of these is bioethic, specialist of bioethics, because in many countries, in Europe countries, in USA, in government we have a specialist of this. Yeah? Because when we spread the resource of medicine, we may understand how the most right action of this. Who at first may took this resource, this treatment, this money for treatment from government? Who is the second? And it's not a simple question, because all of these patients must have a treatment, and its diseases may be a dangerous disease. And we think about this, and it's aspect of bioethics. Yeah? In Russia, we doesn't have this specialist in government. We see that bioethics in a first early step in understanding of the mind of doctors. For example, we see that I doesn't very old teacher, and when I was learning in university, I doesn't learn bioethic, and this discipline start in our education only 10 years or something of this. And very big part of our doctors in our country doesn't see this problem of this object, of ethics standard, of some questions of ethics. And in our practice, in our offline practice, when we see, I see a huge classes and doesn't see any students. When we have our offline classes and when we have a long course of bioethics of all semester, yeah, not lecture course, short course, and when we have this opportunity in our offline classes, we talk about two part of bioethics. Yeah, we have common questions of bioethics, yeah, basis part, and separate part of bioethics. Yeah, and in our course we talk about common questions for bioethics, and it's most important, but sometimes it's maybe not very interesting. I hope that you have some interesting information in this course, and very interesting information lay on some aspect of medicine, and in this time today we doesn't have any clinical mention of we say in English when students start to educate your practice knowledge about disease. We come to clinical from your focus, and you see patients, you will see some dangerous situation in medicine, some difficult decision in our practice. And in this time, you may understand that we have any problem with ethics in our practice, yeah, but it's start in earlier, yeah, in the future. And today we separate only common questions and talk about some common part of bioethics. Yeah, and we on our at start we may talk about Hippocrates. Yeah, you see in slide their living of this scientist. Yeah, I hope that you may hear of this person, you may read on biology and in history of medicine. We talk about Hippocrates. And this scientist who is the first talk about moral standard in our practice in medicine. Hippocrates was very attentively about skills of communication between doctors and patients. Yeah. In our next course, in third course, we have a cycle of our cathedra, and we come to us. I hope we will see your face, and we talk about contemporary situation of communication between doctors, patients, and today we have a very quickly coming problem in this area because all information of our diseases come to our very simple to touch information with internet, and in all countries I think it's same situation when patient at first when they have some problem with health look on internet, and after this they come to a doctor, and patient have some visual of problem, and doctors have different vision. It's very very kind of situation, and we have a problem with communication of this person. Yeah. And Hippocrates in this ancient area understand this, and in this time doctor was try to use some medicine, but we understand what of this. Yeah, some herbs, I don't know, some frogs or roasted any roots, something like this. And at first of this situation, doctor must have communication skills and psychology knowledge about psyche of diseases, about this aspect. Yeah. And another branch of ethics, of history of medicine. It's a very big point of our growth in medicine. This document of Hippocratic Oath. Yeah. Hippocrates start of this practice, and we have a lecture of this, and this time I doesn't tell about this more. We talk about Hippocratic Oath in another time, and we think about this, that medicine in ancient area, medical must think about any standard, about any documents, guidelines of our practice. It's important to understand. And we talk about bioethics in contemporary, in modern understanding what of this discipline after our historic traveling of some years ago, and this time we start to discuss some reasons of born of bioethics. Why we tell about this? You hear that we start to learn this discipline not more time. Some 10 years ago, students in Russia learn this discipline. What happens? Why we start to educate of this knowledge? What's the reason of this? Why we must pay attention of this discipline? And in bioethics, separate three reasons of born of bioethics. Yeah, right. This it's important. We tell a historic fact and try to think about this. Yeah. You see this three reasons. Yeah. At first, it's influence of the ecological mention on the medicine. Yeah. Medical safety. It's the same. The second reason, it's a fight of the rights of human, yeah, and technical progress in medicine. I try to tell about this. These three reasons. At first, and the very famous historic fact we know about this point, this reason, yeah, influence of the ecological mention on the medicine. Yeah. We think ecological when we deliver any rubbish, for example, in your kitchen, and more large understanding of this. It's any substance of our environment, and this substance come to our organism, yeah, from food, from drugs, from another organ, for example, from a breeze, from a skin. Yeah? It's a ecological situation in a place where you live in. It's clothes, what we have. And in medicine, it's very good practice in USA. You may hear this organization. I have some. I do some отклонения, да, от курса, как не знаю по-английски. I do some coming from our course and say some interesting fact in our medical situation of this. Yeah, in USA we have organization FDA. Federal Food and Drug Administration, FDA organization. You may write this, you may search information about this, and we hear this organization when we start your clinical practice on 4 course, and next all your day of practice of all your professional life. We hear and see this organization because it's a huge structure who looking to food and drugs in USA and give agreement to took this treatment and foods. Yeah, it's a common organization. It's interesting. Yeah, drug and foods, we doesn't separate this. In USA, for example, and in our country, we start this progress. I see some day ago I come to Вкусвилл, yeah, shop Вкусвилл. We may see on Russia this Russia distribution of foods, of meals. And I see some biological elements in this shop, and some simple drugs on this magazine. It's a tendency when we see this product on shops, not in Bioaetics, yeah. And in FDA, in USA, FDA give agreement to start any practice of drug. And on this, see all world, all medicals see on this. If pharmacological companies start to distribute, have an agreement to distribute these drugs on USA, in USA, all medicals all over the world understand that it's a good practice. It's because it's very hard process to invite new drugs, for example, in USA. And in all guidelines, we see that this kind of treatment, these drugs have this agreement. And what we see in our history, at the first, it's I think all doctors, all students, all medical students must know about this fact, about thalidomide. Yeah. It's a dangerous situation in our history, and medical take part in this. Yeah. You see that thalidomide, it's a sedative drug. Yeah? You see this wonder drug. We think about this in 1956. Yeah? and this drug was present in the many countries. You see 46 countries in Europe, in Russia. We have this drug in USA. On this time we doesn't have any documents to regulation of this, and these drugs come to USA. And in instruction of this drug was marketed as completely safe for everyone, include mother and child, and even during pregnancy. Yeah. Because in experiment this chemical structure doesn't have any problem in rats, from pregnant rats, and in a tissue of embryo, this drug doesn't create some dangerous effect in laboratory. And pharmacological company think that it's enough to start distribution in mother and pregnant woman. Yeah. And in all country very quickly this drug was distributed. And we see that thalidomide was not tested from potential harm to the fetus in human. Yeah? It was only laboratory experiment. And after this, you see the fact of this practice. More than 100,000 children in many countries were born with several birth defects. Okay? In slide you see phacomelia, phacomelia, dysmelia, you see on this slide. Yeah, dysmelia, amelia, yeah, amelia, and another defect of internal organs, of heart, of lung vessels, eyes, of defect of brain, we see. And for example, what you think about 10,000 children? For example, it's a count of all children who born in Ulyanovsk from 2 years. When we come to our city, you see people, and all of these people create only 5,000 children from a year, from 1 year. Yeah. And it's a big problem, historic, of our practice. In our classes we see this film. You may type in YouTube and see many film about thalidomide strategy. Interesting film. And what happens at last? It's a good material to think about this, because from this time, from fourth, fifth, from middle of previous century, we start a manufacturing period of our period of our growth of humanity. And in pharmacological, it's the same progress. And pharmacological companies start to push her practice, her part of this pay in very, very concrete ocean, red ocean. You may hear this phrase. We have a great book of this red ocean. It's demonstrate that in these areas we have a very concurrent environment, and pharmacological company have hard working to create money of your practice. And on another part of this, we see some ethical problem. In contemporary situation, if we have this fact in modern country of all over the world, some countries, if pharmacological company may do these errors, these fails, it's be death of this pharmacological company, because and this time all laws right by blood, and we must know this and understand this when we hear some problem, some fact. For example, I may tell when a patient with some cancer, for example, search the information of not medicine, how we may treat it, and read that in another country we have a wonder drug to treat this problem, this cancer, for example, and try to pay these methods. Some human work of this and transfer this drug of from one country to another. It's not right to laws, but it's have needed in potential patient. And when we hear this, we may think that all this inertive mechanism of investigation of drugs and come to practice, it's right, it's a rules right by blood, because we know about thalidomide strategy. And fact about our situation, from a time when molecular was synthesized in laboratory, and when this molecule come to a practice, it's maybe a way of minimum 5, 7, 8, 10 years. It's a very, very long way to practice, because we have a 4-step of clinical investigation of this new molecule, and one of 100 molecular goes on her goals to practice, yeah. And it's a first example why we have these rules, yeah. And next point, next reason of born of bioethics, it's a fight of the rights of human. Fight for the rights of human. What are these? In first history fact, in USA, its name of this case is Tuskegee syphilis experiment. Okay. Write this, Tuskegee syphilis experiment. Okay. You see age of start of this experiment. It was 1932. Yeah. In American government, white government, white men think about some problem with syphilis. Today you know that in this time, in first part of 20th century, it's a very pandemic situation of syphilis. Yeah, it's you know the distribution of this congenital way of distribution of this infection. Yeah. And government think about this. Governments understand a big problem of this, and think that if we start an experiment to some small area, and we look how this problem grows. We in this time we doesn't understand what the step of developing of this disease, yeah, and what is what happened with children who was born with this infect mothers, yeah. What happened in pregnancy, for example, we doesn't know this. What organ damaged of this infection, we doesn't know this information. And when government think that it's not big problem, when we start to experiment and we was look on this patient. Yeah? In a small rural area of USA, in Tuskegee, it's a name of this village, yeah? Government start this experiment. Of all, you see that people who live in this area, it was poor black African American man, yeah? And you understand that medical help in USA is very expensive. And in this area, government start experiment and say of this 600 citizen that we have free medical help in our hospital. Yeah, it's our I don't know, charity of you. And this experiment start. What happens in clinical? These patients have medical help from all diseases, yeah? Heart problem, lung problem, all diseases. It have a treatment. It was treated in this hospital, but only one disease. It's a syphilis. And medical, you see in this slide, doctors took any analysis, any investigation of this patient, and doesn't tell about this problem, about this disease. And you understand that doctor doesn't treat this patient. And when this patient was said that I mentioned that I have a syphilis and I tried to treat this problem, Dr. Mas said that it's not problem, it's not dangerous disease, you doesn't have this disease. And after 1947, when penicillin start her great step on medicine, yeah, you may read Harari, yeah, where in a book that it's a huge step of growth in medicine when we create the penicillin, yeah, antibiotics therapy of all infection problem. In 1947, it's all over the world start is treated. And patient in Tuskegee with syphilis come to hospital and said that I want to try treat my syphilis by penicillin. I hear that it's effective treatment, but doctor doesn't do this and say that it's not problem. And in slide you see the victims of this experiment include many numerous men who died of syphilis. Yeah? In 5 course in dermatology we investigate this problem, and in neurosyphilis this patient have damaged the brain, have some problem with lung, and the reason of this is damage of this organ. Yeah? We see that some children was born with congenital syphilis, yeah, of this area. And it's the same. We may look some films in YouTube about syphilis Tuskegee experiment. Interesting fact is that what's the reason of stop of this experiment, and you see data that it's 1972, 14 years old, the continuous of this experiment, and the effect of this when a journalist of New York Times find this information of this experiment, yeah, and type in paper this this fact. Yeah? It's you know that it's a government experiment. Yeah. And it's a 1.2 have a good mention of freedom of speech, yeah, in countries where you live. Yeah. Because we see we have some problem and doesn't have a way to contact with this information. Yeah, and journalists, it's one of these. Yeah, in Russia, for example, it's very problem magazine of new paper on English. Yeah? По-русски это новая газета, вы можете почитать, and you may read this literature, this paper of some acute problem of our country. Yeah, and this magazine has a huge problem with government in her working. Yeah. Okay, and New York Times, it's a great magazine. Yeah, papers. Yeah. And another important, another interesting fact of this experiment that all this time when experiment continues, one person, one black woman was be a chief on this experiment. Yeah? And because black men in Tuskegee hope that it's same people and think about some good things of this experiment. Yeah. Okay, it's a fight of rights of humans, a film of this experiment. Yeah. The next historic fact of the fight of human rights, it's Nuremberg trials. Yeah, Nuremberg trials. Nuremberg trials. One minute, sorry. My chief have a questions. Okay. Nuremberg trials. It's we have some problem with your shadow, yeah, and in our break I see your shadow and we talk about Nuremberg trials. Yeah. After the World War II, we find very dangerous information of medicals in concentration camps, yeah, during this war. And on this time, today, we have a push of this historic fact in Germany. Yeah. At first, very frequently we may hear that German pharmacology and medicine have achievement only on this fact that medicals in concentration camps have opportunity to start experiment of human. Yeah? And another fact about this that in Germany on COVID pandemic, when this start, pharmacological company who create a vaccine in Germany distribute all dose of vaccine to another country, and the citizens of Germany, some part of this said that it's not right because we have our citizen and we need it of vaccination, but government take decision that it's a right when we distribute all vaccine to another country, because on a level of government they think about Nuremberg trials. When this fact take part, yeah? When medicals in concentration camps create an experiment in trauma, in some disabilities of muscle frozen, of bone, of nerve transplantation experiment, and it's dangerous experiment, very dangerous experiment of twins. It's you may find information of this, and after that we have Lowers process. You see in photo and slide this, and all of this Nazi human answer of her action in face of law. Yeah. And it's next fact of our history why we must have a moral standard in experimentation of our practice. And you have these questions. One lecture, in one part of lecture, we talk about this experiment in medical education, in laboratory. Have we moral right to start experiment in frogs, in mouse, in our laboratory? It's a goal of this. It's education of student. These acute questions we talk about this experimentation in medicine. Okay. And the next point of our question today, it's third reason of bioethics is technical progress in medicine. Yeah. We have many facts about this. At first, I tell about God Committee of Seattle. Dr. Scribner, in 1962 create apparatus of the artificial kidney function. Yeah? Apparatus of artificial kidney function. And this apparatus come to practice in some hospital, and in hospital of Seattle, doctors have opportunity to start work on this apparatus. But problem located that it's one example of apparatus, yeah? And it's big technical progress in medicine. Yeah, kidney failure, for example, you may hear this, may read about this something. When patient have problem with kidneys and this organ doesn't work well, yeah, it's organ with big resource, and we see some problem in analyze when only 19% of organ is damaged. Only on this we see that creatinine grows in organism, and we have little time to do something of this. Yeah. Another problem, it's acute situation when a patient have some trauma and kidney have problem. Yeah, and these apparatus separate blood of any rubbish and recycle this blood, this plasma inside of body of this patient, and we may we may continue of living with this patient many times. Yeah. And what happens? Doctors stay face this problem. What we must do when we have 5, for example, patients and 1 operators, and 1 patient may take this treatment. Yeah? And in hospital of Seattle, medical society create these questions. Yeah. Who must take decision of these questions? Who take decision? Who is the first? Who is the second on this treatment? Yeah? Who have a chance to continue of living, or who must die? It's not simple question, and medical in Seattle said that it's not only medical questions, and create some commission. Yeah, the name of this God committee. You see, God committee of Seattle. Yeah, and in this commission take part government, lawyers, very famous people of society of this country, celebrity, any different society, part of society of this country, yeah, white and black in Seattle, for example, yeah, and it's a fact in if we have a test on our credit, it's the questions of this: who doesn't take part in God committee of Seattle, yeah, and it's professional, it's a doctor, yeah, because doctors said that it's not only our problem. It's problem of government, of society, of philosophy, I don't know, but not problem of doctors. I want to help our patient, but I doesn't took decision who is the first, who is the next, who have chance to continue living, who no. And it's situation come to our practice not earlier in pandemic of coronavirus. We have this problem. In all countries we have many patients. We start a problem when many patients come to hospital with lung problem, with breast problem, and we must artificial lung function apparatus, must do this, but we have a limited count of these apparatus, because many years, for example, in my hospital where I have practice, we have 3 operators of artificial function in our reanimation urgent отделение, как это, реанимационный блок, да, reanimation block, yeah. We have 3 operators, and many years we have 1-2 patients with this problem, and in one time we have 5, 10, 15, 20 patients from this problem of lung and artificial function. We must do this. Who must take decision? Who lay on this bed with artificial function apparatus, and who must lay on a small bed in outside of this urgency block and doesn't have a chance to save her life. It's a huge problem, and in pandemic we start this thinking of this. Yeah. Okay. Okay. I think we have a break from 15-20 minutes and